Now I'll be discussing pharmacology of 3 drugs in one video. And the reason why I'm discussing these 3 drugs in one video is I actually got to know about these drugs when I was trying to talk about study about what treatment for malaria, okay? And I got to see that sulfonamides, tetracyclines, and clindamycin can be used in combination for treating malaria, okay? So that's why I said that, okay, instead of trying to talk about the pharmacology of these drugs one by one, since they are mostly used in combination, why not just talk about their pharmacology altogether, okay? So that's it. In talking about the pharmacology, we are not like joining, all right? So we'll talk about these drugs when we are done. Like, let me say, we talk about what sulfonamides. When we are done, we'll move to what tetracyclines. When we are done, we move to what clindamycin. All right, that's how we'll be doing it. All right. So we said that here is an overview of the pharmacology of what sulfonamides, tetracyclines, and what clindamycin. All right, starting with the first drug, which is what sulfonamide. This is a chemical structure. All right, and this is how effective this drug could be in treating a lot of what bacterial infections. Okay, so the class of sulfonamides is what antibiotics. If you say drug is antibiotics, that means it has an action against bacteria. Okay, mechanism is it inhibits bacterial dihydropteroate synthase. Okay, it's an enzyme, and this will now interfere with what folic acid synthesis. All right, so there will be no folic acid that will be synthesized for the bacteria. Okay, thereby inhibiting its growth or paralyzing it. Okay, so its spectrum, it has an action on what gram-positive bacteria, that's like Staphylococcus, Streptococcus, right? Also have an action on gram-negative bacteria like what Escherichia coli, Klebsiella. Also have an effect on some protozoa like what Toxoplasma, all right? So these are the different types of what infections that you can use this word sulfonamides to treat. Acute or simple urinary tract infections, acute otitis media, streptococcus pneumonia infections, Haemophilus influenza infections, shigellosis infections, and the traveler's diarrhea. Okay, all of this you can use what these sulfonamides to actually treat it. Then examples of these sulfonamides include what sulfadiazine, sulfisozazole, then the trimethoprim what sulfamethoxazole. Okay, so this is the trimethoprim what sulfamethoxazole that we have here, right? Pharmacokinetics. It has an oral absorption, it's distributed throughout the body fluids, it is metabolized in liver, it is excreted in urine. Okay, adverse effect. It has some hypersensitivity reactions, right? Nausea and vomiting, diarrhea, Steven Johnson syndrome, all right? Like that's the side effect of these drugs. That's the sulfonamides. So having done with the sulfonamides, we'll be moving to the next drug, which is what tetracyclines. And here you can see this is a bottle containing capsules of tetracycline. This one too, all right? Tetracycline. So this drug, its class is still antibiotics. That means it has actions against bacteria. Okay, mechanism, it binds to the bacteria 30S ribosomal subunits. Okay, when it binds to it, it will therefore now inhibit protein synthesis. And every organism out here actually need protein to survive. Okay, just trying to reply my bro. All right, spectrum is it has action on what gram-positive bacteria, gram-negative bacteria, and even atypical bacteria. All right, if it is effective against organisms like what chlamydia, mycoplasma, rickettsia, and spirochetes. Okay, apart from the bacteria, it's also effective on these organisms. Then moving to the next, which is the examples of tetracyclines. We have the tetracycline itself. We have the doxycycline. We have the minocycline. All right. Then pharmacokinetics has an oral absorption. That's you have to take it through the oral route. It's widely distributed in the body fluids. It is metabolized in the liver. That means it has the first pass effect, right? It is excreted in urine and feces, right? That's basically the excretion. Then okay, and the adverse effect is if you are taking this drug, it can cause things like what? Gastrointestinal disturbance, like stomach upset, diarrhea, and the rest. Okay. Can also cause photosensitivity, can cause what? Hepatotoxicity. That's like it will be toxic to the liver. All right. Okay. Then it can also cause tooth discoloration. That's mostly in children. Okay. Then moving to the next drug, which is what? Clindamycin. All right. Clindamycin is classification is under what? Lincosamide antibiotics. So you can see that these drugs are actually what? Antibiotics, but when you combine them, they actually have an effect on the parasites for malaria. Okay, so it binds to the bacterial 50S ribosomal subunit. It will now inhibit protein synthesis, right? It has action on what? Gram-positive bacteria like Staphylococcus, Streptococcus. Also has effect on what? Anaerobic bacteria like what? Bacteriotes and the Fusobacterium. Examples of this clindamycin include clindamycin itself and lincomycin. All right. Pharmacokinetics, it can be given through the oral route of drug administration or the parenteral route of drug administration. Right. Widely distributed in the body, metabolized in the liver, and excreted in urine and feces. All right. Adverse effect is what? Gastrointestinal disturbances, pseudomembranous colitis, skin reaction, hepatotoxicity. All of this could actually set in um, if you um, if you use that drug. Okay, so that's it from a for the pharmacology of what? Sulfonamide, tetracyclines, and clindamycin.